Hi everyone, welcome back to the Dr. Sia channel. In the video here today, which is the third in a series of 4 videos, I'll be talking about attachment and regulation. In this video here today, we're going to be talking about disorganized attachment and regulation. Let's get started. Alright, so if you want to know what I mean by regulation, check out my video on avoidant attachment and regulation where I explain what regulation is also. So when we're talking about a disorganized attachment and regulation, in stark contrast to both avoidant and ambivalent attachment, there is no regulation in a disorganized attachment. So people will then often ask me, say, so when do they then get regulated? Well, they don't. There is no regulation in a person with a disorganized attachment. There's a consistent and persistent self-abusive way of relating to their world. And the only times where they are regulated, so to speak, is when the world stops bringing those triggers to them. Meaning they only feel good about themselves when their boss stops being abusive, when finances are set, looks good, relationship functional, when the real world stops bringing them pressure and complicated situations and hurt, then they can seem calm and feel relatively okay. Sometimes they gotta sabotage. Anyway, it's huge. The area is huge. I don't want to further confuse. But the only times that they can, by and large, feel somewhat calm is when the world stops putting pressure on them, stops hurting them. There is actually no regulation in disorganized attachment. There's chaos. There's no actual formed pattern. There's self-harm. There's drinking. It's almost as though when you're of a disorganized attachment that you pursue your whole life just trying to find that regulation, just trying to find peace. My disorganized patients will say to me, all I want in life is to just have that thing that it seems like other people have, where they can just be calm within themselves, peaceful within themselves, even for a moment. So if you have a disorganized patient or a friend or a colleague or a partner, your main goal to help is to help them find a way of regulation. And ideally, you want to help them towards something called co-regulation, where you help them regulate and they also help themselves regulate. Now, how can we achieve that? In my next video on secure attachment and regulation, I'm going to describe that, because that in essence is what secure attachment and regulation is. So if you're curious about how you help somebody co-regulate, check out my next video. If you liked this one, please do press a like. If there's more you want to know about this disorganized attachment and regulation, let me know. Press that like button. It really helps people come to these videos. If you think my information is useful, more useful, or equally useful as some of the things that are out there, please do press that like button. I appreciate it. I'll see you again next time. The way I ended that sentence seems like I had something more to say. Did I? I do have lots to say about disorganized attachment. Anyway, trying to keep the videos short. See you next time. Okay, I still I can't press it. You know, you have that sense that you forgot your keys before you're about to leave home and you go, gosh, what did I forget? Nothing. I don't know. All right. Are you still watching this? You're a true champion if you're still watching me ramble on about myself. I'm gonna have to go now.